Are we finally over COVID-19? With many countries easing or erasing restrictions, can we put the coronavirus behind us? Or could complacency leave us in even greater danger? I'm Andrea Sankey, and today's newsmaker is COVID-19. In the 2 years since the pandemic started, more than 6 million people have died from COVID-19. But it's not just lives that have been lost, it's livelihoods too. With nations forced to introduce severe restrictions to stop COVID contagion, millions lost their jobs as entire economies ground to a halt. But in 2022, in most parts of the world, it almost feels like the pandemic is over. In many of the wealthiest nations, governments have been lifting restrictions rapidly. Take the UK, for example, which in February unveiled its Living with COVID strategy.
We will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test.
But on the opposite end of the spectrum, China is returning some cities to lockdown. Shanghai's 26 million population is facing some of the toughest restrictions possible after a spike in cases. Beijing has been pushing a zero COVID strategy, but for some residents, it's simply unrealistic and unfair.
I think this whole operation is causing a lot of harm to many people and a lot of suffering. And I don't really believe that is necessary or appropriate.
Now, China has one of the highest vaccination rates in the world, just like many European nations. And that's why countries like the UK, France, Italy, and Germany may have been able to ease restrictions. But lower-income nations are still well behind in their vaccine rollouts. Take a look at the numbers. In high-income nations, more than 71% of the population has received at least one COVID-19 vaccination. It's much higher in places like Canada, where 87% have had at least one shot, and in France, about 81%. On the other hand, in lower-income countries, less than 16% of the population has been given at least one shot. It's even lower in Somalia, with 12%, and Mali at just 7%. Well, this pandemic has been unpredictable. New variants are still causing concern. The BA.2 Omicron subvariant has some scientists on high alert. And with so many still unprotected, the World Health Organization is warning against complacency.
Depending on where you live, it might feel like the COVID-19 pandemic is almost over, or it might feel like it is at its worst. But wherever you live, COVID isn't finished with us. There's no borders.
So if COVID isn't finished with us, are we dropping precautions at our own peril? Here to discuss that now from London is Global Health Advisor Oksana Pyzik. She's also a senior teaching fellow at the University College London School of Pharmacy. In Oban, Scotland is Dr. Daniel Goyal, an NHS Medical Consultant. And from New York, Edward Kelley. He was the director for the WHO's Integrated Health Services and is now the Global Health Lead for Apiject, its company working on vaccine deployment. Thanks all so much for being with us. Oksana, let me start with you. You know, we've heard public officials say, health officials, that it's not over, but still, is at least the worst behind us?
Well, it's certainly not over. Here in the UK, particularly in England, we saw that 1 in 16 people actually tested positive for COVID. And that's even now with the COVID tests no longer being free here. So we can really see that the spread is continuing, even if it's not dominating the headlines. But in terms of, as you hint at, is the worst over? Certainly the severity of Omicron has translated in fewer hospitalizations. But more recently, we have seen that ambulance wait, A&E wait have all started to climb back up again. So, you know, in terms of that, health systems and health workers are still over the past 2.5 years, that continued pressure is starting to show cracks. So while I think the good news is that Omicron is milder, less people are being hospitalized, many health systems still struggling with the aftermath.
Okay. Daniel, I think I understand that you're on at least the same page there. But do you think there is a dangerous level of complacency at this point, especially now that restrictions have been dropped, weather's getting warmer, people are spending more time outdoors and feeling less threatened by the virus?
Yes, certainly do. I think, COVID is still the leading cause of death from all infectious diseases worldwide. It's the third leading cause of all deaths in the UK. We are unable to keep up with it in the healthcare system. So therefore, the knock-on effects to other conditions is tremendous. I mean, we've never had waits like this for cancer treatments, for A&E, etc. This is not the time to be de-escalating our protections and mitigations. This is the time to actually be escalating and getting society used to a life where we're using high-grade masks when we're out in public spaces, we're ventilating public buildings, and we're encouraging everyone to get vaccinated. Because for whatever mildness we may get with Omicron, that is only achieved through vaccine uptake and to some degree past infection. So we shouldn't get complacent at all. This is still a huge killer.
I mean, you must really despair then at the government really dropping all restrictions.
Absolutely. I mean, we are in the front line. All my colleagues are just staggered by, what we're seeing day to day. I've been in the NHS for 20 years, never seen things as bad as this before. I mean, in fairness, we didn't have a good healthcare capacity before this started, but, to in the face of so many millions of people in the UK suffering, there's 7 million on the waiting list nearly for operations and things, highest ever the country's ever recorded. I mean, to let mitigations grow. And the one thing, if I can say, the one thing that really grates me is to remove the need to self-isolate if you're actually positive.
I mean,
we're talking about a contagious disease. Yeah.
does the government not listen to doctors like you? I don't understand how they can reconcile this, what you're saying, with what their policy actually is.
Absolutely. I mean, even our chief scientist officer, our chief medical officer, they were quite clear that, that this was a big risk that they were taking. The story we're getting is that they're not really listening to that advice at all, and they're following their own agenda here. I think it has become politically inconvenient. COVID is, people in government are fed up of it. What's interesting, though, is that the public aren't, and the public may be fed up of COVID, but actually only 17% of the population supported self-isolation to end. So I think what we're seeing is a small minority of people driving this agenda, and what we need to get back to is proper public health measures and thinking about the public first.
Interesting. I mean, and it's also interesting that there seem to be very few political consequences for the leaders that are crafting these policies, and seem to be ignored. Yeah.
Yeah. I mean, I think it's amazing that there's not more uproar in the media about it, if I'm honest. But I think Prime Minister Johnson's polls are tanking at the moment, and I think he will feel it on election day because the public do feel abandoned by our leadership here. So
Okay.
I do hope that sense prevails, and we are able to tackle this more logically.
Okay, fair enough. Edward Kelley, let me ask you, I mean, is the picture the same in the United States as what Daniel's described?
It's not exactly the same, but I think Daniel's points are a warning sign for the Americas. Through the entire outbreak, we've had the UK and Europe been about 3, 4, 5, 6 weeks ahead of us. There's been a general relaxation here, pushing for masks to be coming off on planes. If we were broadcasting, if I were broadcasting from a place that I've been many times, Hong Kong, this would not even be a question. Right now, there's not even enough coffins to be able to manage the dead bodies in Hong Kong, which is a system that is highly developed, a very good hospital system there. And the issue has been, and it'll be worse actually in the US, because we have slightly lower vaccination rates than parts of Europe. And we have pockets which this virus will exploit. We're now in a new phase of the outbreak where the virus will exploit pockets of vulnerability and continue to evolve. And you'll see new variants. And you'll also see increasing numbers of cases of long COVID with these long symptoms that anytime you get infected, you can be at risk for. So I think a lot of implications that need to be thought of as we think about where we go next with public health measures.
Right. I do want to talk more about long COVID in just a second, but I need to ask you first, Edward, I'll stay with you because you bring up Hong Kong, which is such an interesting case. Here you have China with such high vaccination rates, yet the case numbers in Hong Kong are surging. Hospitalizations are surging in places as well. Was it perhaps that the vaccine China was using is known to be less effective than the vaccines being used in the US and Europe, or is there something else at play entirely?
Well, there is the overall issue, I think, and this is globally, but particularly for China, is that we had a set of, I guess, dangerous beliefs about COVID that are not necessarily connected to reality. And in China's case, they had done an excellent job, a very strong public health response that probably could not have been replicated because of the structure of their society and a lot of other places, but still very strong. But it wasn't adjusted to when a new variant, Omicron, came that was more infectious than could be controlled by typical lockdown measures. And this is the main point that countries haven't realized, is that you have to assess and reassess your approach and be better at communicating that to the public. So that's one piece of it. Definitely low vaccination rates among the elderly in places like Hong Kong, and lower efficacy for the Chinese Sinovac and Sinopharm vaccines. And you can see it now. There's been adjustments to bring in other vaccines for some of their booster doses.
Okay. Oksana, let's talk about the vaccines then, now, and how well you think they've worked over the course of the past year plus. And, of course, do you think we still have a price to pay then for not getting the world vaccinated, and the issue that you have looked at extensively, vaccine inequality?
Yeah, I mean, if we look per inhabitant, high-income countries have 9 times more doses of vaccine than in low-income countries. And being even at the point where we are now, I mean, it's indisputably because high-income countries have, on the whole, had very high vaccination rate, which has driven down the overall mortality rate. So tremendous success with that, even if we see that in terms of transmission, et cetera, it over time wasn't as effective in blocking. However, because the Omicron variant is less severe, and if there's a new variant of concern that emerges, it doesn't necessarily mean that it is going to be more mild. I mean, that's the best case scenario. The worst case scenario is that we know the virus will continue to evolve, and we could see something that would require new vaccines in future. And that's why I think it's dangerous to go into dropping monitoring, reducing testing, because we're going into potentially a different ways with a different variant, more blind, and we could be on the back foot again. And another thing that the vaccines have been really show to be helpful for is with long COVID as well. It, in some extent, hasn't prevented long COVID, because we know on the ONS data that 1.7 million people are living with long COVID. That's 1 in 37 here in the UK. And that 780,000 people have had long COVID for more than a year in the UK as well. Undoubtedly, vaccines have given some protection against that. It hasn't prevented it, though. And the data is still out in terms of whether it can shorten the duration of that long COVID experience as well. Hopefully that is the case.
Okay.
But vaccines have been, without it, we would be looking at a very different picture. And anyone that was trying to argue otherwise with the natural immunity argument, it just doesn't stand up to the evidence.
Got it. Edward, I could see you had a comment. Go ahead quickly.
Yeah, I just wanted to add to the really good point that Oksana makes on this vaccine inequity. The issue now is not at the beginning of the outbreak, the question was, could we get vaccines that would be effective? The question now is not vaccine doses. Can we get enough? It's, can we get enough vaccinations done in places where it's difficult to vaccinate. Actually, you have some great footage of vaccination centers that show the most common procedure in the world, vaccinations. It's not actually that easy of a process. What we need are better approaches, mobilizing community health workers, using simpler tools like, for instance, pre-filled syringes, single-dose syringes, and getting those
Okay.
out to countries to make sure that we can get these vaccinations done in places where it's difficult to get them done.
Right. And vaccines aside, Daniel, let me come back to you. Why why aren't we hearing about herd immunity anymore? I mean, has that been collectively building alongside the vaccine rollouts, the infection rates? Are we getting there? Because that was, we heard nothing except that in the beginning,
Yeah.
that's what we were building toward. And now it's unheard of. Where has it gone?
Yeah. Well, I mean, I think it was a false prophet, if you like. It's the suggestion that if we would get to herd immunity through just allowing the infection to run, as was the case in a number of countries, has been widely discredited now. I mean, I think we are developing some tolerance, if you like, to SARS-CoV-2. I think as time goes by, we're less likely to overreact to it, which is the hallmark of severe disease. But I think at the same time, the virus is quite adaptable, more adaptable than I think we thought initially. And so, it just
Yeah. So,
keeps
I mean,
us
is it
stating.
fair when we hear it compared to a severe flu? That would seem pretty. No.
No, yeah, I'm sorry, I have a bee in my bonnet about that one, I'm afraid. I really take issue with comparing the either the severity, the infection fatality rate, or actually your mortality risk with flu. It's much, much more serious than that. I mean, in terms of direct deaths from the infection, SARS-CoV-2
Okay, maybe not
is in
so
a
much
league
in
of
the
its own.
severity of it, but when you think about how we treat the flu every year, getting new
Yes.
vaccines every year, is that what we're facing with COVID-19?
I think you'd be better asking one of the others because
Okay.
I'm more of a more clinically frontline type thing.
Ed Kelley,
So
go ahead.
Yeah, no, I mean, with building on Daniel's point, I don't think we can compare this to the flu, except in this aspect that you raise, which is that we will have to be doing boosters until we get a new generation of vaccines. The idea that it's going to be okay for people to get infected and that's how they're going to acquire their immunity is just not sound medically. If you don't know which case will turn into severe case. You don't know which case will turn into long COVID, but it is clear that we're going to have to be running seasonal campaigns for boosters heading into the next period until the next generation of
Will
vaccines
the
comes.
boosters be able to keep up?
Well, so far the boosters have been effective. The current batch of vaccines that we have is effective against the latest variants, Omicron, BA1, BA2. We're just seeing new variants like XE, and we'll have to study that. But there's no indication that they wouldn't be effective. The data from the countries that are far out in terms of their fourth booster, like Israel and others, show increasing jumps in immunity levels, which is what you want to see to protect particularly the most vulnerable. And we'll have to be looking at the strategies for those booster doses, balancing, of course, the need to get much of the world, even their first dose, to raise immunity levels globally if we're going to manage the possibility of new variants.
Okay. Oksana, then
can
let's
I
go.
ask Andrea?
Yeah.
Sorry, can I ask Andrea, Dr. Kelly, do you think that there will be some sterilizing vaccines soon, or is that something of a pipe dream or possible?
Yeah. Well, there's 300. It's a great question, Daniel. There's 300 vaccines in the WHO's pipeline for approval. At the moment, they span all sorts of vaccine platforms.
I
So
think
far,
we have to
none
understand, though,
of the
what is a
ones that are.
sterilizing vaccine in this context?
Yeah, good point. That would be a vaccine much like the measles vaccine, where once you're vaccinated, it really provides a protection against infection in the future. And then in the current versions of our vaccines, we have some protection against infection, but really we're protecting against serious illness, but
Okay.
you're not sterilized in terms of your protection. So nothing in the very immediate pipeline of the 10 vaccines that are about to be approved looks to be sterilizing. So it's a
Understood.
ways off.
Okay, Oksana, then let me come back to you. We're down. Time is dwindling. So we wanted to talk about long COVID, and how much is still really unknown on that front. How serious the repercussions can be, as well as these still unknown secondary symptoms that we're seeing with COVID, particularly with Omicron, from eye infections to skin rashes that can get extremely severe.
Yeah, I think the clue is in the name, long COVID. So we'll take cohort studies to really understand the knock-on effects and the secondary complications that arise from this. And the symptoms that people have reported have been very wide-ranging, including hair loss, difficulty sleeping, exacerbate new cases of diabetes being brought on. And certainly, it's going to hit the most vulnerable populations the most. And so, some of our other panelists have said, that they're very discouraged by the fact that this hasn't been discussed as widely in the media at this time. That because people have really grown bored, COVID fatigue, etc. But when we look at people who have already underlying health conditions, those who are in less countries where their vaccines, either through access or just because the logistics aren't there, those doses aren't translated into jabs and arms. Overall, we're going to need so much more effort to fully understand, and having the research in place, the funding in place, the investment in place to have enough long COVID clinics around the world for scientists and medical professionals to treat people accordingly. And hopefully we'll see that if there are going to be a new generation of vaccines used, if they do have this sterilizing effect, that reinfection will not trigger long COVID in patients again, because that has been a concern among some. So lots of work to do on that front.
Right.
And I think another point Ed Kelley made that was really quite worth repeating is that we don't know, there's so much variability. So it could be that a young, fit, healthy person does end up having, a almost inexplicable severe case, or inexplicably severe long COVID. There's so much variation there. And that's why taking these unnecessary risks, stopping isolation, stopping free tests, these are things that we could continue to keep economy rolling while having those services available.
Right. So, I mean, we'll finish with this. We started this program asking, or this debate asking, if the worst of the pandemic is actually behind us at this point, because we have had the vaccines, in certain countries, the rollout has been remarkable and effective. And now, Daniel and Ed, let me address this with you. We also have these antivirals that are supposed to be on the market. Paxlovid and molnupiravir are the two most prominent. Why hasn't that given more of a sense of relief and safety in all of this? Daniel, go ahead.
Yes, I mean, it's is available here in the UK, particularly to the immune compromised. The results of the initial trials look fantastic. And I think certainly on the front line, we are reassured by having that tool in the toolbox. And certainly if someone comes in now with COVID, our expectation is they will survive, whether old, whether immunocompromised, as opposed to you go back a year and we were happy for someone to survive in terms of sometimes quite surprised. So it has changed the game. I think the other treatments, the steroids, and we're just better at treating it, has certainly changed the game. And if you do get sick and you do get attention at the right time, which is early, then your chances of survival are much better at this point in time with this amount of vaccine coverage that we have now.
Okay. Edward, your thoughts then? Because, now we do have more tools in the toolkit, but for some reason, especially the antivirals, kind of fallen off the radar. There was so much promise at first that it was the game changer. Haven't heard much about it, but does it make us safer?
It definitely does make us safer antivirals too, and building on Daniel's point, that in a lot of countries, you do have a different diagnosis, or prognosis rather, as you go into the hospital with COVID. The bottom line is that we have such an emphasis on vaccines We haven't dealt enough with vaccination, and we haven't dealt enough with therapeutics. But right now, unfortunately, even though there is availability of these effective therapeutics in richer countries, we are duplicating the vaccine inequity that we've seen around the world in low and middle income countries with the therapeutics inequity. And there's a very, very constrained supply, even actually in places like the United States, for these therapeutics.
Okay.
So, yes, it's another tool in the toolbox, but not everyone has access to that toolbox.
Got it. Edward, unfortunately, your connection seems to be dropping there. You sound a bit robotic at the end, but that will have to be our final word for this edition of The Newsmakers. I'd like to thank all three of my panelists really so much for being with us. Our viewers, of course, for tuning in as well. Remember, do subscribe to our YouTube channel. I'm Andrea Sankey, and we'll see you next time.